associate professor in the College of Health at Lehigh University. So today's session, I'm hoping would be a very small and intimate and engaging session where all of you have a chance to discuss the environmental injustice at a local level. So the overview of our session is that we will be beginning this session with a brief look at the very seminal air pollution episode that we know of in the whole world, which happened in Dontora, Pennsylvania. Then move on to this decade-old legacy event in Braddock, which is also right outside of Pittsburgh, Pennsylvania. Then move on to a discussion, a very brief look at the state of air quality in our neighborhood, the Bethlehem, Pennsylvania. Then finally, I hope to engage all of you in a lively debate on what we ought to do about this segregation of pollution. So I always enjoy starting my talk with the bottom line first. And I thought I'd like to frame our discussion in terms of the three key contributors in my mind, including the biological and physiological susceptibility of the persons, as well as the social vulnerability, which both interact and get augmented by the environmental exposure inequalities. So these would be the three factors that contribute to ongoing injustice issues and also represent an opportunity for an action. So the very first event that we know of involves an environmental air pollution disaster back in 1948 at the height of the American Industrial Revolution, right outside of Pittsburgh. So just to give you a context of where Dontora is located, I highlighted put the pin with the pin where Dontora, Pennsylvania is located, right south of Pittsburgh. And just to give you a context in a very quickly, Pennsylvania in the turn of the 20th century attracted number of migrants into the Pittsburgh area as they built these whole host of industrial complexes. But the shape of the land was such that it's a basin, surrounded by mountains. So, I mean, for more than hundreds of years, I mean, it was very prone to air pollution episodes, as you see here in 1910, right along in this area along Pittsburgh. So the town in question, the Dontora, is a little bit south of Pittsburgh, as I've shown you. And in 1948, it had experienced this very unusual weather event where, as you see in this background picture, you see these factories spewing these fumes in the background. And it happened in conjunction with this unusually quiet weather where there was no wind to wash away the fumes in the background. So result was that it turned into a soup of pollution during of approximately 5-day period where this toxic pollutants were trapped for about 5 days in this region. And why does this happen? Just to give you a very quick idea as to the conditions that facilitate this kind of an air pollution episode. It happens as a result of this warm air that traps the cold air underneath it and prevents the pollution that is embedded within the cold air underneath from escaping. So under normal circumstances, during say, in a very windy and sunny summer days, the vertical mixing would allow the pollution to escape vertically along with the temperature upwards. But temperature inversion happens much more frequently during winter when the temperature change happens much more rapidly and suddenly without accompanying movement in air, so that the pollution does not have a chance to escape it but get trapped by this something of a blanket of warm air on top of it. So what happened in Donora? Let's take a very brief look.
Settles down on the industrial town of Dontora, Pennsylvania, and brings with it mysterious...
Oops. Sorry, I'm just going to maximize my volume just so that, could you all hear this well?
Settles down on the industrial town of Dontora, Pennsylvania, and brings with it mysterious death. Residents have difficulty in breathing the murky air. 20 die, 400 others are stricken with respiratory ailments. Oxygen tents care for sufferers in the town's community center, transformed into a hospital. Investigations are launched. A local zinc plant suspected of emitting poison smoke is closed down. Rain brings relief, but an epidemic of pneumonia is feared in the wake of Donora's deadly plague of smog.
So I was hoping that we can move on quickly to the next event, which is that right after we learn about what happens in Donora, that doesn't compel most of us to change behavior. Instead, in Braddock, Pennsylvania, also right outside of Pittsburgh, there has been decade-long legacy of environmental injustice, which is so elegantly told by this one film. Sorry about that.
Braddock was always declining ever since I remember. Ever since I was a kid. It boomed in the 1920s at 20,000. By the late 1950s, when I was going to school, it was already down to about 12. My name is Tony Buba. I'm a documentary filmmaker. I was born in Braddock right before World War II in 1943. My dad, when he came back from World War II, was full-time in the mill. He had 40-some years before he retired. Braddock was always an integrated community, unlike some of the other mill towns, but it was also segregated within that integration because most of the African-American population lived in an area called the Bottom, which is down by the mill. If you look down, there's the mill, it's just spewing. Through the history of the mill, African Americans were always discriminated against. They always had the worst paying jobs, plus the worst working conditions. Working in a coke area, a working area where there's a lot of cancer and a lot of lung disease.
They called them man-killing jobs. They were basically doing the work that they would not dare send a human being in to do because You were breathing in things that would actually just kill you later on. My name is Isaac Bunn, and I'm a resident of Braddock, PA. My family in Braddock dates back generations. My grandfather, great-grandfather, father worked in the steel mills. They migrated from the South to gain employment. I remember stories that they would tell me. It was bigger than downtown Pittsburgh. It was populated with businesses and movie theaters. And I mean, you didn't have to go out of the town because with steel workers, they all came into the communities. There was high-end things. It must have been something to see.
What happened in the late 50s and the mid 50s, what whites did is they ended up moving into this newer housing. The suburbs were being built. African-American families, even though working in the mill and making enough money to buy one of those homes, you couldn't get the loan, where a white worker could get the loan. African-Americans bought homes in Braddock. And once they started moving into Braddock, then white flight started taking place, so the composition started changing.
When I was coming up, it was in the phase where the mills were leaving. White flight was already probably at its end. It was just abandonment, neglect, and the plumes of smoke. These things have been flowing in the air for generations. You didn't know or understand the effects that it would have on your body later on.
My family has just been a lot of cancer. My brother, my cousins, my mother. There's like 6 people out of 10 or 12 of us. So it's like half people gotten cancer. I mean, what is that? My dad put a notice down at the employment office not to hire me because he never wanted us to work in the mill, me or my brother. When I went to college, because I was one of the few people from a working class background that was in film school, in some ways I filled a void. I just started, doing these short pieces. Braddock, where have you gone? I had images of working people on the screen.
I remember when I was a boy.
And what I wanted to do was make the films stand by themselves, but then also you could play them together over the years and see this 40 or 50-year arc of one community, this change of what has happened. The mill was there, and it's always a character, would have this sort of deafening sound.
All of my life, this constant sound, the sound of the mill. And the sad part about it is not everyone who gave their lives to be a part of it can benefit from it. My father, to me, it just seemed like he was always at work. When he retired from the mill, he didn't have much time to enjoy his retirement because at that point it became a struggle to survive. Hospitals, oxygen machines. It's a slow, painful way to leave the earth after working all those years.
My dad, he retired at 63. He lived to be 82. A lot of African-American men retiring at 63 only lived to be 66 or 67. Whites with a little bit more money maybe lived up on the hill, so you didn't quite get all as much as the people that lived down by the mill. These are things that, the people just don't think about it long term and what happens. Everybody works hard, but you have that advantage of being a white male in a society at that period of time. And there's things that drive me crazy with the white community that just they don't look at, oh, we all grew up equal. They think, no, we didn't grow up equal.
What I like about Braddock is that it's a place where my family has been for generations. But for me, it was just about survival.
Thank you. So based on this historical perspective, I mean, I like to move our attention to what we do know about Bethlehem, Pennsylvania. And I have not done, in full disclosure, I have not done the study to present you rigorous data in this session. And this session, this slide comes from one of my students who had done the research as part of the class project. But what we do know about Bethlehem, Pennsylvania, is that we are afflicted with one of the worst air qualities in the country. It receives a grade of F in terms of ozone pollution days. It ranks as the 55th worst metro area in the country for smog. It experiences very frequent inversion episodes and has a number of pollutants of concern, including the nitrogen oxides, sulfur dioxide, carbon monoxide, and volatile organic compounds. So with this, I mean, I like to open the floor for discussion in terms of these three factors we do recognize as the traditional contributors to environmental injustices, and turn the table on this legacy, and how as to how we could do this. So I'm going to stop sharing and allow you a chance to share your thoughts if you're interested.
Thanks, Hyunok. This was great. I love that film. So when you look at Bethlehem, and I don't know if you know the answer to this, but I mean, obviously smog's a huge issue. Do you know which resulting health conditions are the biggest problems here? I mean, I'm assuming asthma. What else are we seeing?
Oh, whole host of other health events. And to be honest with you, I am a little biased because I've been studying asthma, so my attention has been predominantly focused on asthma in children. And it really is not good. I mean, the national average prevalence of asthma is about 9 to 12%. In this region, it's close to 30%. 30, yeah. And that's like even higher than some of the worst areas in New York City, such as Bronx. So there is tremendous amount of work to be done in this region.
Are you seeing racial ethnic differences too?
Yeah, that data is still not very clear. I haven't been able to access this data. But what we do know is that in regions north of Philadelphia, I mean, the racial and ethnic disparity in not just asthma outcome, but also a whole host of other health outcome was just tremendously astounding. I just couldn't believe that in this day and age, we experience this strong disparity. So it's time to, I mean, move our research focus from, this biomedical, researcher-driven perspective to, and bring us to where the problem is, where the people are at. And I mean, I'm hoping that this would be a beginning of a new way to do research, where we do go to these affected communities and build strong relationships and give the power back to people. So I do see a question from the chat. Has anyone on your team connected with schools to work on educational focus and connections? Yes, in fact, we are working on that. We are very, very fortunate that we're forming a strong relationship with the Bethlehem area schools. Up until the pandemic upended all of our efforts. We're hoping that we would be able to continue where we left off once we are able to meet and work with people. But the Bethlehem Area School Board has been incredibly gracious and supportive of our interest in working with the children in schools at all levels, ranging from grade school to all the way to high school. Any other questions, thoughts? I mean, I have another question from the chat box that can you go into a bit more detail as to what you are doing in the schools? Oh, so being that our school is our College of Health is extremely new, this is all the things that we are interested in doing. First of all, we need to be able to translate anything into tangible actions. We need data. We can't do much without data. And I'm just going to go back to my original slide, which is this, that if I were to envision these three factors as the opportunity for action, we need also the data that would identify the specific susceptibilities that are associated with each of these factors. So that is where we're hoping that our collaborative efforts would translate into doing more deeper studies, both case control and prospective cohort studies with the children in this region. But what I could tell you at the moment is that the data is very sparse in this region. It's very mysterious because we have highly averaged concentrations that makes it look as though we live in a fairly safe region. But in terms of the health outcome and air pollution episodes, it's completely contradictory to what I see in terms of the annual averages. Any questions, comments? So we have another comment from the chat box that has this data begun to influence public policy, such as local municipality utilizing more clean energy? To my knowledge, the answer is a no. We are caught in this very strange catch-22 where we don't have the direct data to translate into a public policy, but a strong suspicions and strong circumstantial evidences that support the need for such policies. So, this is, I'm hoping that our team comes in and collect that data that links that circumstantial evidence regarding incredibly high prevalence of asthma with the appropriate policy.
I'm wondering if the schools would be open to maybe some of us as researchers coming in, and even if we just did a quick cross-sectional survey to find out, prevalence of asthma and other health sequelae. And then maybe some really simple focus groups with parents, kind of asking them the kinds of things that they would like to see done. I mean, just as kind of a starting point, I think that would be a really simple way to kind of get things started and get our researchers, because we are so new. I mean, many of us got here very recently, to just start getting involved and start to figure out, what kinds of things people would be open to doing. Because I always hate it when researchers just walk into a community and say, well, here's how we're going to fix your lives. And like, you don't know, you have to get the community's input on that. And so I'm wondering if there's something really simple we could do, maybe with some students from one of the programs. I know the Mountaintop program has all kinds of resources and things that maybe we could get some students involved.
That is an absolutely brilliant point. Yeah, I couldn't agree with you more that, to be honest, that's how I was trained. And for me, that moment of hard reckoning happened when I went to South Africa and saw workers in vineyards covered in pesticides, so much so that they looked like some kind of a white ghost, like some kind of this, like people plastered in like white, complete white dust. And it really made me, made me think, I'm sorry, go ahead. So anyway, I couldn't agree with you more, Dr. Daly. Any other questions? Yes. Could you unmute? You're muted.
There we go. Okay. So I had messaged you in the chat as well, but I'm in the College of Education up on top of the hill. But in my other life, I'm the Environment and Ecology Content Advisor for Pennsylvania. And there are some really good programs that could potentially be used to get into the school connected to the U.S. Department of Ed's Green Ribbon School program. And one of those huge focuses in that program is environmental justice or injustice, environmental health issues, and community relations. So please contact me and anyone else who's on the team. We do some programs all around the state, so.
Yeah, maybe we could do a simple cross-sectional, survey and just look at the baseline need and the desires.
Right.
And,
I also have direct connections to the DEP Environmental Justice Office. So I think they could probably, between them and the Department of Ed, could help put some of those pieces together. So if it's okay, I could also connect you with Allison Acevedo.
Yeah, thank you so much. That sounds great. We'll definitely do. Thank you. Any other questions, comments, concerns? So we could go back and look at the interview with Dr. Bullard on the disparity of air pollution and environmental pollution exposures, because he has some truly insightful suggestions. If you don't have any additional comments, we could do that. Would you like to go back to watching the video briefly? Okay, since none of you are responding, I'll just assume that's a yes. And we'll go back. Sorry.
The United States of America is segregated, and so is pollution. Those words from our next guest, the so-called father of environmental justice, Robert Bullard. As a sociologist in the 1970s, he shone a light on how minority communities in Houston, Texas suffered most from pollution. Since then, he's written more than a dozen books on sustainable development, environmental racism, and climate justice. And he's been talking to our Walter Isaacson in Texas as part of our ongoing initiative about poverty, jobs, and economic opportunity in America called Chasing the Dream.
I have been absolutely fascinated by the concept of environmental justice. Tell me what that concept means and how you became the father of that.
Well, environmental justice embraces the principle that all communities are entitled to equal protection of our housing, transportation, employment, and transportation, energy. And so it's a concept that's rolled in equal protection, equal access, equal enforcement. And it's not a fuzzy issue. It's an issue of the right to live in a neighborhood that's not overpolluted, a neighborhood where your kids can play outside on the playground, that's not next to a refinery or a chemical plant.
And that's how you got into it. It was 1978.
1978. That was so long ago. And it was an accident. It was an accident. You know, my wife came home one day and said, Bob, I've just sued the state of Texas, and I've sued this company that's trying to put this landfill in the middle of this suburban, middle-class black community in Houston. And she said I needed somebody to collect data for this lawsuit and put where the pins are.
Oh, sorry. Oh, sorry about that. I was just trying to increase the volume. Just want to make sure it's maximized so we can go back.
The United States of America is segregated.
With like 7 landfills, how many of those 7 were in African-American neighborhoods?
Well, what I discovered from the 30s up until 1978, that 5 out of 5 of the city-owned landfills were in black neighborhoods. 6 out of 8 of the city-owned incinerators were in black neighborhoods, and 3 out of 4 of the privately owned landfills were in black neighborhoods, even though blacks only made up 25% of the population during that period of time. And this is in a city that's the 4th largest city, in a city that doesn't have zoning, so somebody was making these decisions, and what we found is that it was not random. Everybody produces garbage, but everybody doesn't have to live next to the landfill. And it was not just a poverty thing. The subject of the lawsuit, Bean versus Southwestern Waste Management Corporation, was a middle-class black neighborhood of homeowners. 85% of the people own their homes. And so it was not a poverty pocket, it was not a ghetto. This was a solid middle-class neighborhood of houses and people and trees.
The city council of Houston that's making that decision back then, what's the racial makeup of that city council?
All white.
All 7?
All 7.
Yeah.
So you get this whole idea of environmental justice also means having access to decisions that are being made and making sure that it's access, and that no one segment of our city or county or region should be making decisions for other people. And so the idea that this was a policy of not having individuals on that city council in that room saying, well, let's not just put all the landfills or the incinerators or the garbage dump in this one area. And so it's a matter of equity, a matter of fairness, and a matter of civil rights.
And how does climate change affect this?
Well, climate change, if you look at environmental justice, climate change basically overlays this whole issue of who has contributed most and who's going to be impacted the greatest. And if you look at the footprint of climate change, and climate change is more than parts per million and greenhouse gases. It also includes who's most vulnerable, who's going to have the burden of living in these areas that are going to be hit hard, whether it's droughts, whether it's flooding, or whether other kinds of issues. And again, the climate change, sea level rise, will exacerbate the inequities that already exist. You know, if people are poor, they're in low-lying areas that's prone to flooding, you're going to get more flooding. You're going to get more droughts and more disasters. You're going to get more of the issues of the widening gap between haves and have-nots, and you're going to get this whole piling on effect of not having, a level of resilience to bounce back because of a flood.
So let's be specific. You were here for Harvey, right? How many inches of rain did Harvey dump on Houston?
52, 53, whatever. Nobody counted on that. I've worked on environmental justice and climate issues and disasters for 40 years, and working with other communities that have been, forced to evacuate. I never had to be evacuated until Harvey. In this case, it was very unique for me and very unique for a lot of people because in some places, some neighborhoods, some areas had never flooded before.
How did the city flood, white areas versus black areas?
Well, if you look at the GIS map, studies just came out last year showing that the communities that historically that have flooded over a period of time, we're not talking major storms, we're talking mostly African-American, Latino areas in terms of the east side. You divide the city in half. Harvey basically followed that pattern, even though a large part of the city flooded. The areas that got hit the hardest are the areas that historically, that have always gotten hit hard.
Houston's famous for not having many zoning laws. How does that affect things?
Well, as a matter of fact, Houston is a no-zoning city, and it's very proud of that. And, it's unrestrained capitalism, and it means that historically it's the only residential protection land use devices with renewable deed restrictions. But the fact is that we have a lot of our land uses that's willy-nilly, a lot of building that's in areas that we probably shouldn't be building in, and the idea of how do we make corrective action that's happened over the last 50, 75 years, it's hard to do that now. So that means that we have to come up with sensible planning. We have to talk about how we're going to, in some cases, probably restrict the kinds of development that most cases would be dictated by money as opposed to some common sense. And so,
Wait, give me an example of that.
Well, in terms of a lot of the houses that flooded on the western part of the city were built right up to the reservoirs and Alex Barker, reservoirs. And those houses, we're not talking low income, middle income. We're talking very well-heeled families, $1 million, $2 million homes that were built in a floodplain and that were built in areas that with an event like Harvey is bound to flood. And you talk about what it means to provide protection, not just for well-heeled communities, and the idea that if we can provide the kinds of flood protection and flood mitigation and the kinds of restructuring of our land uses and allow for some communities to somehow relocate, it has to be a plan that brings a lot of communities to the table. And historically, Houston has not been a city that has been diverse when it comes to decision making. It's been mostly a top down. And so I think Harvey has brought a lot of the rethinking of what that means.
Has Harvey brought people of different socioeconomic and racial groups together?
Oh yes, oh yeah. But you have to look at it and say it took a biblical flood to bring a lot of the groups and organizations that generally have not worked together on a lot of issues. Organizations that work on wetlands and prairie issues of environment, pollution, industry, transportation. It brought a lot of groups together. Almost 3 dozen groups came together and decided that we need to be talking, we need to be working together. And we came up with this organization named Coalition for Environment, Equity, and Resilience, SEER. And again, the heart of that whole thinking is an equity lens. And one of the first things that we did is we came together and came up with this framework. And we presented the framework, equity framework, to the county, Harris County, and they basically adopted this whole idea that future development and future funding of projects dealing with Harvey or flood mitigation or going forward must be looked at through an equity lens.
So
Houston,
this slide, this
how segregated
talk
is it
goes on
racially?
for about another 10 minutes. However, if you were in my class, I would probably stop all of you at this point and get back to this point and ask you, as the future leaders of this country, what would you do to solve the legacies of environmental injustices in Bethlehem, in northern Philadelphia area. So I am hoping that I may break you into perhaps a few breakout rooms and ask you to jot down ideas, just like in my class. Uh, Except that I am learning that there is no breakout function in this medium. So pardon me for my inability to do that. Oh, so I just got a word that we could do breakout rooms.
Yes,
So
I can assign them. I will do that right now.
great, thank you so much.
Okay.
Maybe about 3 groups. So the challenge here is for you to address all 3 main challenges. And I pointed out let's go back to the slide. I pointed out the biological and physiological susceptibility, social vulnerability, as well as the environmental exposure inequalities. So if we were to flip this on its head and saw this as an opportunity for an action, where do we start, in order to get there? That's my question to you.
Okay, I'm going to start the breakout sessions now.
Thank you so much, Lauren.